Topic 2. The trauma effects of sexual violence. Sexual violence is a traumatic event. The word trauma originates from the Greek term for wound. Very frightening or distressing events may result in a psychological wound that causes difficulty in coping or functioning normally following the event or experience. Traumatic events can be life-threatening or involve a significant threat to physical or psychological well-being. Experiences and events that can lead a person to experience psychological trauma include acts of violence such as an armed robbery, war or terrorism, natural disasters such as bushfire, earthquakes or floods, interpersonal violence such as rape, child abuse, or suicide of a family member or friend, involvement in a serious motor vehicle accident or workplace accident. Other less severe but still stressful situations can also trigger traumatic reactions in some people. People with intellectual disability experience the same effects of sexual violence and abuse as all victims and survivors. At the same time, the experience of intellectual disability presents additional factors that can impact the effects of abuse. The effects of sexual violence and abuse include emotional, psychological, physical, and behavioural effects. The emotional effects or feelings associated with trauma can include feelings of powerlessness and loss of control, guilt or self-blame, embarrassment or shame, anger, fear, alienation or isolation, loss of confidence or reduced self-esteem, or emotional numbness. The psychological effects or thoughts associated with trauma can include anxiety, sleep disturbance, depressive symptoms and/or major depressive episodes, post-traumatic stress syndrome, flashbacks, an experience of reliving a past traumatic event as if it is occurring now. They usually include vivid imagery and extreme emotions that can last for seconds or can continue for hours. A dissociated state can last for several days. Protective denial. It is very common for survivors to repress some or all of the abuse as a way of coping with the abuse and being protected from the intense emotional pain experienced when the abuse was taking place. Sometimes the gaps in memory protect the survivor from recalling the details of the abuse, and in other situations from remembering that any type of abuse occurred at all. Physical effects. Short-term physical effects of sexual violence include physical injury, pregnancy, or sexually transmitted disease. The long-term physical health problems associated with a history of sexual trauma in women include irritable bowel syndrome, abdominal pain, vaginal pain, breast pain, headaches, musculoskeletal pain, pelvic pain, and pelvic inflammatory disease, painful periods, heavy or prolonged bleeding, sexual dysfunction, non-menstrual vaginal bleeding or discharge, rectal bleeding, bladder infection, painful or difficult urination. It is important to note there may be no sign to indicate that sexual abuse has occurred. Understanding the effects of sexual violence can help us recognise indicators of sexual abuse. The most reliable indicators of sexual abuse are disclosure, physical injuries, and significant behaviour changes. Behavioural changes are a common way to express distress following an experience of sexual violence or abuse for victims with or without intellectual disability. However, for people with an intellectual disability, behaviour changes can be overlooked or attributed to their disability. It is very important to pay attention to any behavioural changes and explore why these might have occurred. For people who have restricted communication skills, it is especially important to involve significant others who may be better positioned to notice behaviour changes and/or to understand people's attempts to communicate experience of abuse. Behavioural signs that shouldn't be ignored are disturbed sleep patterns and/or distress about going to bed, angry or violent outbursts, loss of personal modesty, changes in sexual behaviour and/or inappropriate behaviour, fear of going out or being alone, reactions to specific people or to a specific gender, use of sexual language not used before, new obsessive behaviours, self-harm, change in people's attitude to personal assistance during bathing, changes to incontinence, avoidance of preventative health care such as pap smears and breast examinations. It is important to note that the presence of particular signs or indicators does not always mean that sexual abuse has occurred. Something else may be troubling the person. Likewise, it is important to remember there may be no visible signs to indicate that sexual abuse has occurred.
Thank you for completing Topic 2, Understanding the Trauma Effects of Sexual Violence. Topic 3 will look at vulnerability to sexual violence. But first, please return to the home page to complete the learning activity.